Hey everybody, welcome to itis week. And you may be thinking, who, what? What is she talking about? This week we are covering all things inflammation. So if we want to describe something that is inflamed in the body, we basically stick itis on the end of the name. So pancreatitis, anybody ever heard of that? Arthritis, hepatitis, that's the liver. So we talk about encephalitis, that's the brain. So we talk about all these different inflammatory diseases. We're just going to put itis on the end. So today I'm just going to talk about what inflammation is, what causes it, and when it becomes a problem. And then throughout the week, we are going to focus in more specifically on different types of itises that are some of the most common that we see. So, there are different kinds of inflammation that can occur. It normally is divided into 3 phases, but we're going to talk about kind of the active acute phase versus chronic inflammation. So the active acute phase of inflammation is actually a good thing because it happens when there's an insult to the body. So that insult could be trauma. It could be like a cut or a bump or a bruise or a fall. It could be an infection, something, a viral infection, fungal infection, bacterial infection. Could be anything that sets off this cascade in the body. So when inflammation first starts, when there's that first trauma or the bacteria first gets settled into the bladder or the lungs or the skin, wherever the problem is, the body responds and tries to heal that itself, and it responds with inflammation. So basically we get hallmarks of inflammation, which are redness, swelling, and heat, and with those comes pain. So the redness is because the blood vessels, first they constrict if there's any bleeding so that bleeding would stop, and then they open up and dilate, and then they actually become a little bit leaky. And the reason they do that is, one, we want to bring red blood cells to the area because they're bringing nutrients, they're bringing oxygen. And then we also want to bring the white blood cells because they are going to either eat bacteria or viruses, or they're going to bring chemicals in that are going to help clean up the area. So the blood cells the blood vessels become leaky because we want to allow the red blood cells and the white blood cells to actually get into the tissues and destroy whatever is causing that initial insult to the body. So all of that is great, and then the white blood cells will produce antibodies. So let's say it was parvovirus that got in, or it was Lyme bacteria, they're not, Lyme spirochete that got in. So the white blood cells are going to come in, they're going to try to attack that, they're going to try to kill it, and then they're going to make antibodies so that if the body gets attacked by that same thing in the future, it will recognize it and the armies will arrive faster in bigger numbers and get rid of it more quickly. So that's all great. When let's say, well, I've got a cut on my finger. So I cut my finger, I got the redness, the pain, the swelling, and now it's working on healing and it's going to develop a little bit of scar tissue in that area. So that's what happens after we have that inflammatory response. But what happens if the inflammatory response doesn't go away? What happens if it now becomes a chronic inflammation? We see that really commonly with certain diseases like Lyme disease. So we get chronic inflammation of the kidneys, chronic inflammation of the heart muscle, chronic inflammation sometimes in the brain, chronic inflammation in the joints. And that's where this inflammatory process continues. And so we get that heat and that swelling and that pain associated with inflammation that didn't go away. And the problem is that that chronic inflammatory condition can actually keep the immune system going in such a state that we develop what is called autoimmune disease, where instead of just attacking that original organism or whatever caused that initial trauma, it then starts attacking tissues of the body. So for instance, in arthritis, the cartilage gets broken down, and the synovial fluid, which is the cushioning fluid in the joints, becomes thinner and more watery and not as cushioning as it used to be. So these chronic inflammatory conditions actually start a destructive process in the body. So for instance, chronic pancreatitis, chronic inflammation in the bowel, inflammatory bowel disease, anyone? So a lot of things can contribute to this chronic inflammation. One of them is obesity. And obesity is actually an itis. We should call it fat itis because it's actually an inflammatory condition within the body. And those fat cells are producing hormones and inflammatory chemicals within the body. We also know that the added stress of extra weight on the body causes more degradation of the joints and mechanical problems. And we'll talk about that more when we talk about arthritis. So things that contribute to chronic inflammation, obesity is definitely one of them. Eating poor quality foods definitely contributes to that. Vaccinations are a huge contributor, particularly over-vaccinating. Pharmaceutical drugs that destroy the gut flora. We know that the gut flora, the microbiome, has a huge effect on the immune system and producing things that decrease inflammation, producing feel-good hormones, all those kinds of things. So when we give prescription drugs or chemical parasite prevention and treatment, we are destroying the gut microbiome, setting up chronic inflammatory problems. Poor diet can be extremely inflammatory because when we feed something that is high heat processed, has a lot of synthetic additives in there, has a lot of carbohydrates that break down to sugars, those are all things that contribute to inflammation. There's something that happens when we combine proteins and carbohydrates and cook them at high heat. We get something called AGEs, which are advanced glycation end products, which are highly inflammatory. We also know that many processed foods, particularly those using poor quality ingredients, are very, very low in omega-3s. So the omega-6 to omega-3 ratio is really out of whack and it's really high. We want that omega-6 to 3 to be very, very low. So when we look at some of the really high quality raw or gently cooked foods on the market, we're going to find that they have omega-6 to 3 ratios of 2 to 1 or sometimes even lower. I just saw one the other day, it was 1.37 to 1. That's incredibly low. Whereas some of these more processed foods like the kibbles, that ratio might be 30 to 1. And there were actually studies that showed that some of those kibble and highly processed products actually had 0 amounts of EPA and DHA, which are the good omega-3s that we want. So if we don't have those omega-3s, we are not decreasing inflammation. We're actually increasing inflammation. So diet can be really critical. Environmental toxins like glyphosate, huge in their endocrine disruptors, and they contribute to inflammation. Stress and anxiety, this one we cannot talk about enough, and I think we need to really be focused on it. Maybe we'll do a focus week on this, because stress and anxiety for us and for our animals has been shown to be a huge producer of chronic inflammation, and chronic inflammation leads to cancer. Not so good. So, how do we treat inflammation? Well, from a Western medicine perspective, we're going to use non-steroidal anti-inflammatories. Well, we all know that they come with their own subset of problems, issues, and side effects. Steroids, problems, issues, and side effects. Immune suppressants like Apoquel or Cytopoint. Lots of problems associated with those. So, natural anti-inflammatories that we can use instead, fish oil. Very high in omega-3s. So anything that's high in omega-3s, whether that's a phytoplankton, an algae oil, calamari, krill, fish oil, all high in omega-3s. Egg yolks are high in omega-3s. CBD is an amazing anti-inflammatory, so we certainly can use that as well. I'm missing my last page there. Okay. Antioxidant foods. So we know that fresh berries like blueberries, raspberries are great antioxidants. Most of our pets will eat them really well. Colostrum is another good antioxidant, really good supplies immune globulins that the body needs to balance out the immune system. Dark leafy greens, vitamin C, vitamin A, vitamin D, vitamin E, all great antioxidants and anti-inflammatories. Green lip mussels are amazing. What else do I have? I'm missing a page. Okay. PEA. PEA is huge. So that's palmitoyl ethanolamide, and it actually plays really well with CBD. When you combine those two together, you get an amazing pain-killing and anti-inflammatory effect. Get rid of chemical cleaning supplies and anything in your house with artificial fragrances, because those can set up a huge inflammatory cascade in the body as well. And we know that there are many studies on the human side that show that chronic inflammation leads to cancer. Why do we have a cancer epidemic in people and in animals? Yeah, has a lot to do with this chronic inflammation and the chronic inflammatory state that is set up by over-vaccination, overuse of chemicals, and feeding poor quality diets. So, simple changes that can be made that can really help decrease the itis in your animal. So hopefully you'll stick with us for the week, learn about different itises that we see quite commonly, how we treat them, and how we can prevent them.